Good afternoon, ladies and gentlemen. It is a great pleasure to welcome you to this webinar, which is co-hosted by the European Academy of Childhood Disability and Nestlé Health Science. And it is a great pleasure for both myself, Dr. Arnob Seal, and Dr. Marco Connings to present this on behalf of the European Academy of Childhood Disability. The webinar is regarding the impact of COVID-19 on children with neurodevelopmental disabilities, their families, and also professionals who are working with the children and their families. I am Arnob Seal. I'm a consultant in neurodevelopmental pediatrics at the Leeds Healthcare in Northern England. And I am the current chair of the European Academy of Childhood Disability. I'm also the current chair of the Global Professional Education Committee of the International Alliance of Academies of Childhood Disability. I would like to invite Dr. Marco Connings, my colleague, to introduce himself.
Yeah, thank you very much, Arnob. So I'm Marco Konings. I am the back office coordinator of the European Academy of Childhood Disability. And in that role, I've been involved in the development of the surveys, as well as the coordination and the dissemination of them and the subsequent analysis of the surveys. Next to that, I'm also a postdoctoral research fellow at the KU Leuven, Department of Rehabilitation Sciences, where I'm involved in various research projects, among others focused on technological solutions for people with dyskinetic cerebral palsy.
Thank you, Marco. We will now present our findings from the survey, and we will have a time for questions at the end. We would encourage you to keep sending in your questions throughout the presentation, and then right at the end, we would be able to take your questions one at a time. And hopefully we will have a good discussion regarding the findings from the survey and your thoughts regarding the way forward. We will present our findings for about 30 to 35 minutes, following which there should be adequate time for discussion. Before we start, I would like to make a disclosure of conflicts of interest. Neither Dr. Connings nor myself have any potential conflicts of interest, financial or otherwise, regarding the conduct of the survey or regarding this presentation. The European Academy of Childhood Disability did not receive any financial support from any third party regarding the survey or regarding this presentation. We are all aware that the COVID-19 pandemic has been raging for the last 18 months or so. From the time that the first case was reported in the Wuhan province in China back in December 2019, there has been successive waves of the pandemic, which has raged over different parts of the world in different continents, leading to many different governments having lockdowns and different measures to try and contain the virus. This has had a significant impact on the health of populations, including that of children. Fortunately, children seem to be less affected by the direct effects of the virus. However, the indirect effects of the lockdowns and the different restrictions placed have had significant impact on the health and well-being of children, and in particular, children with disabilities. We would hope to expound on these over the next half an hour or so from our findings. A little bit about the European Academy of Childhood Disability. The EACD is an association of professionals working with children with disability. We are a registered European charity. We are a multidisciplinary organization with members representing a wide variety of professions. Our missions and values are to support children and young people with disabilities, their families across Europe, and the promotion of education and research into childhood disability. Our values are centered around collaboration, knowledge, inclusion, and integrity. Conducting surveys is not new to the EACD. We have had past surveys centered around advocacy. And the last one we ran was back in 2017 to monitor the effects of austerity on children with disabilities, their families, and also professionals across Europe. We commissioned the survey to look at the direct and indirect impact of austerity cuts on the services for children with disabilities. We looked at the experience of families with disabled children and young people across Europe, and the views of professionals who provide the services for them. This was published in a supplementary edition of the Developmental Medicine Child Neurology back in 2019. And the salient findings from the survey, which is the EACD Austerity Survey back in 2017, the families told us that the quality of services had decreased substantially, access to therapists had become more difficult, access to welfare support and benefits had become much more difficult compared to 3 years prior to the survey. Professionals working with children with disabilities told us that the conditions of working were significantly worse. There was less time allocated to see each child, and there was increased waiting times for services. And all of these was compared to 3 years prior to the survey. Based on that background information we gathered in 2017, within a couple of years, the COVID-19 pandemic had struck, and Europe was in the throes of it, and we realized that this was going to have a far more significant impact in an already bleak scenario. So we organized and commissioned the European Academy COVID-19 survey to understand the impact of COVID-19 on individuals with a childhood disability, their families, and on professionals working in the area of childhood disability across Europe. We also wanted to understand how to support individuals with a childhood disability, not just now, but also during future pandemics or any serious global event or threat. We wanted to know how to support them best during their everyday lives by being better prepared to provide the best possible care and support as society recovers over the next few coming years. I will now hand over to my colleague, Dr. Konings, to tell us a little bit about the methodology of the surveys and the key findings from the survey.
Yeah, thank you very much, Arnab. So what did we do exactly? So in order to gain insight into the impact of the COVID-19 pandemic on children with disabilities, their families, and service providers and professionals from all across Europe, we developed an online survey aimed for family caregivers, and we developed an online survey aimed for professionals working with children and young adults with a childhood onset disability. These surveys we developed were translated in 19 different European languages, in which the preliminary translations of the surveys for professionals and for family caregivers were translated from English into 18 different languages using online translational software, and these translated surveys were then validated by EACD contacts who were fluent in the appropriate language. Both the family-focused and the professional-focused survey were online accessible from April 26th to May 31st, 2020, and disseminated via the EACD and its network, with an essential role here for our network of national coordinators who were crucial for the dissemination of the surveys at national level. An important thing to note here is that participation in these online surveys was of course completely voluntary, and as such we performed a cross-sectional voluntary response sample survey among 1,663 professionals from 30 different countries working in the area of childhood onset disability, and 1,719 families from 30 different countries with one or more individual with a childhood onset disability. So both surveys covered a number of different subtopics. So the family survey included subtopics with questions about, among others, certain characteristics about the survey participants, including questions about the age of the child, the type of disability, and their dependency on others. We asked them questions about the direct and the indirect impact of COVID-19 on their general health and well-being. We asked them about their access to education and the contact of the child with his or her teachers and his or her classmates and friends. And finally, we also asked them about their access to healthcare services and their provision of healthcare services, in particular during the survey period. So for the professional survey, we more or less covered the same subtopics. So again, we asked for certain characteristics of the survey participants, this time more focusing on their profession, what kind of organization they were working for. We asked them about the direct and indirect impact of COVID-19 on their own general health and well-being, but also on the impact they had noticed on the families and their patients. And finally, we asked them about their ability to provide healthcare services during the survey period, and particularly focusing there on whether they were able to provide emergency care and non-emergency care. So the surveys consisted of both open and close-ended questions. The close-ended questions were analyzed using quantitative analysis. The open-ended questions were analyzed using qualitative analysis. All right, so what we will do now is present you an overview of the most important outcomes out of the surveys, and we will do this by covering three key outcome areas. One, the strong decline in treatment provision. Two, the isolation of families and the burden placed upon them. And three, the future challenges and opportunities, including among other the fear for long-term implication, the use of telemethods, and the involvement of families within the treatment process. So starting with the strong decline in treatment provision. As we all know, to reduce the spread of COVID-19 and to flatten the curve, to avoid overwhelming healthcare services, many restrictions and measures were put into place by most European countries. They included, among other, recommendations on the practice of isolation and on the practice of social distancing. However, it appeared that unintentionally, these measures and restrictions reduced the availability and access to healthcare services and treatments provided to children and young people with a childhood onset disability. That is, about 70% of the family caregivers reported a reduction in the amount of treatment and therapy they received during the survey period in April-May 2020. 49% of the family caregivers even reported that the individual with a childhood onset disability did not receive any treatment or therapy at all during this survey period in April-May 2020. And only 26% of the respondents on the family caregiver survey stated that their child or young adult with a disability received the same amount of therapy as prior to the COVID-19 pandemic during the survey period in April-May 2020. This can also be seen when we look at the indicated amount of treatment per week on average. So before the COVID-19 pandemic on your left and during the survey period on your right, where it becomes apparently clear that there has been a significant reduction in the received amount of treatment per week, with almost 75% of the respondents indicating that the child or the young adult received not more than a maximum of 1 hour of treatment per week during the survey period, as can be seen in both figures by focusing on the brown and red colored part. In addition, the number of children or young adults who received more than 5 hours of treatment per week strongly reduced from the situation before the start of the COVID-19 pandemic, from 34% to only 7% during the survey period. Now, in particular, these last findings suggest already a very worrying signal that the most vulnerable may have actually been disproportionately hurt by the COVID pandemic and the accompanying measures. And unfortunately, this appears to have actually been the case. Because if we look at the indicated information on treatment provision and make a distinction here between the individual with a disability being as dependent on others as age-matched peers, being partially dependent on others, or being fully dependent on others, we can see that prior to the pandemic, as you can see on top, the more care dependent one is on others, the more treatment the person received per week on average, as you would expect. However, during the survey period, so during the first wave of the pandemic, these differences in amount of received treatment provision based on how dependent you are on others completely dissipated, which you can see clearly by looking at the brown colored parts in the figure. Now, these are, of course, just numbers, but what we should keep in mind here is that behind these numbers are real families and real people. Therefore, we also want to share with you some of the representative examples we received among the responses from family caregivers about the decline in treatment provisions, which included respondents saying all appointments cancelled, all support withdrawn, even discharged in some cases, so we will need new referrals after lockdown. Another one saying that my child requires physiotherapy checks from professionals. These sessions normally last an hour, multiple times a week, every couple of months. Now a video chat of half an hour attempting to pinpoint areas of improvement by watching through a webcam is the best we have. Or someone stating that I'm concerned about my daughter's decline in her ability to walk and her ongoing pain as we are waiting on an MRI. I'm also trying to do physio myself to try and help her, but it's difficult. And finally, also someone stating, we are worried she gets COVID-19 if she has to go to hospital. We think we will keep her home and accept the consequences of this decision. Now, as you can see here, this reduction in provided care occurred over basically the entire spectrum of types of treatment and therapy, with a very steep decline in the number of children and young adults which received physical therapy, occupational therapy, speech and language therapy, surgical treatment, and somewhat less steep declines, but declines nonetheless, in medical treatment, drugs treatment, and diet therapy during the period April-May 2020 in comparison to the situation before the pandemic. In this perspective, these outcomes correspond to our outcomes from the professional survey, in which physical therapists and speech language therapists indicated to be relatively less able to provide emergency treatments to their patients with a childhood onset disability in comparison to other professions. Likely linked to the type of therapy lending itself possibly worse to remote alternatives because they require, for example, physical contact, or because the patient not being able to express itself very well, and particularly in the case of speech and language therapy. Interestingly, we also found that professionals working for public organizations were relatively more able to provide emergency treatments than professionals working for private organizations and professionals working from non-profit organizations during the survey period. Furthermore, if we look at non-emergency care, physical therapists, physicians, and speech language therapists were relatively less able to provide non-emergency treatments to their patients with a childhood onset disability in comparison to other professions. How and why did this happen? So based on our analysis of the received responses, this involves a wide variety of reasons that led to barriers for optimal treatment provision. First, implemented measures led to, for example, to many professionals being redeployed to another area or being only allowed to provide acute or emergency treatments, or practices being closed or services severely limited. There has also been a postponement of a lot of treatment decisions, for example, because there being no alternative method which could sufficiently replace regular treatments or therapies or consultations. As very often assessments or diagnoses are very difficult to impossible without face-to-face meetings or physical contact. Many reported that communication with patients and families became more difficult using remote methods due to the loss of body language and non-verbal communication. Many professionals reported difficulties in getting in contact with some families and with maintaining a follow-up with these patients, in particular when there are cultural or language barriers. Contacts were also hindered due to various technological issues or a lack of resources by either the therapist or the family, which could be related to financial reasons or a lack of availability in equipment or a lack of time or a lack of space. Professionals indicated that their everyday activities just took more time during that initial wave of the COVID-19 pandemic, with less support available from supportive services, such as administration and IT, and less team discussions with other professionals. And finally, a very important one, patients not coming back to the healthcare setting out of a fear of contagion or out of a lack of time due to the closure of schools and institutes, and being required to take care not only of the child with a disability, but quite often also for the other children within the family unit. So this impact on treatment provision transitions quite naturally into our second key outcome, the isolation of families and the burden placed upon them. Now, as you can see here, 69% of the caregivers reported a very high to extreme burden being placed upon them during the survey period, with 40% of them reporting it as an extreme burden being placed upon them during that period of April-May 2020. Now, to highlight the severity of the situation, we would like to present again some representative examples from the responses we received. So we have again here a respondent stating, all therapies to be done by us and we are exhausted. Another one saying risk of child being affected if accesses services, risk of sole caregiver becoming ill, loss of respite, day service, risk of caregiver burnout, isolation, or teleworking is very difficult when the children are home. The access to necessary therapies is low. We tried teletherapy, but it takes a lot of time from us. The homeschooling also doesn't help. Combining this with house chores makes 24 hours a day too less. We're overloaded, overstressed, and simply tired. And finally, someone stating, we are now even more isolated on our own than usual. In this respect, we have found that this burden being placed upon the family caregivers can be linked to a number of variables. First, the stringency level of implemented COVID-19 measures. With the more strictly implemented measures in a particular country, the higher burden being placed upon the family caregivers. Second, the relative amount of the gross domestic product spent on disability care, with the less amount spent on disability care by a country in percentage of the gross domestic product, the higher the burden being placed upon the family caregivers. And thirdly, the dependency on others of the person with a disability, where the more dependent on others, the higher the burden being placed upon the family caregivers. There are also clear indications that the COVID-19 pandemic had an enormous impact on the mental health of the individuals with a childhood onset disability. About 49% of the family caregivers indicated to have noticed an impact on the mental health during the survey period. And 77% of the professionals reported to have noticed a mental health impact on individuals with a childhood onset disability due to the COVID-19 pandemic. Additionally, 56% of the family caregivers reported that the individual with a disability displayed more behavioral issues. 16% reported that the child had less appetite, and 28% indicated that the child was sleeping worse than usual. Now, the ability to cope with the situation of the person with a disability appeared also to be linked to a number of variables. The first one being the amount of contact with teachers. And the more contact they still have with their teacher, the better they were able to cope with the situation. Furthermore, the same applied to the amount of contact they had with their classmates and friends. With the more contact they still had with their classmates and friends, the better they were able to cope with the situation. Highlighting here the important social function of schools. And finally, again, the dependency on others of the person with a disability, where the less dependent on others, the better they were able to cope with the situation. But the situation did not only impact the mental health of the children and the young adults with a disability, though, it also impacted the family caregivers and the professionals themselves. 62% of the family caregivers reported increased levels of stress and anxiety during the COVID-19 pandemic. But we would also like to highlight the 70% of professionals who reported increased levels of stress and anxiety during the survey period, in which a lot of professionals indicated to be very worried about the families who were difficult to contact, mainly accompanied with fear of missing children who need referral, and were expressing a feeling that they were not able to do enough for these families. So to conclude, the impact on families has been immense due to a combination of different aspects. First, the combination and balance of work, family, and caregiving was severely disrupted for many, and suddenly they were required to be a teacher, a therapist, a psychologist, and a caregiver all at once. This all in combination with a sudden loss of daily structure for many. This led to no time anymore for other family members or other social contacts and strong feelings of isolation. At the same time, it's good to note that every cloud has a silver lining, and a lot of family caregivers indicated to actually have appreciated the increased amount of time that they could spend with their most close family members within their family unit. Nevertheless, many caregivers reported feelings of uncertainty about the future and loss of income, often accompanied with feelings of fear, anxiety, stress, and even frustration. Many families also reported a feeling of not being heard and a lack of support by the relevant authorities during the survey period. And finally, it's good to note that although most family caregivers experienced a strong increase in the amount of burden placed upon them, for some, more or less the complete opposite happened, with not being able to see or visit their child for multiple weeks or even months, in case the child was living in a care facility or institution that closed its doors and did not allow any visitors. And this brings us to our third outcome, for which I happily give the word back to Arnab.
Thank you, Marco. I will now look at the third key outcome from our survey, which is around the future challenges and the opportunities that presented itself. Let's first look at the challenges, and these were around the long-term implications. There were a number of concerns expressed by both families and also by professionals. Families expressed their concern regarding the long-term effects on the children and the fear of worsening of the conditions, both physical health worsening and mental health due to the lack of treatment. Professionals expressed concerns around a lot of families not being able to access healthcare out of fear or due to the lack of practical solutions to accessing different healthcare settings. Professionals also worried about families who were difficult to contact and were among the most vulnerable in society. And there was also the fear of missing children who needed referrals but weren't being able to access their referral sources. Families expressed uncertainty about the future, the loss of income, often accompanied with feelings of fear, anxiety, stress, and frustration. Professionals noted the immense burden being placed on families and the associated negative health impacts on families. However, there were certain opportunities that were also noted as a result of the pandemic. And one of the key silver linings to this pandemic was the explosion in telehealth across most services, including those for children with disabilities. We noted that there were certain major advantages, for example, the contact with the child in his or her own context, which is the home context. Observation of the child was possible through videos. No transport was needed. There was improved access to care for people from remote areas. And also, it was much more economic and time efficient. It also led on to development of certain remote assessments particularly around assessments which could be done without actually physically examining the child. There were, however, significant disadvantages also noted. For example, there were technical issues with network and software capacity. There were digital poverty concerns, which was around access to high-speed internet and availability of that across different settings. There were hardware, software issues, but also a lack of knowledge for caregivers or for that matter from professionals in terms of managing sophisticated software. Physical examination was not practically possible. There was also the concerns about loss of body language, and one of the major concerns was around cybersecurity and data security and data protection. A number of different methods of telehealth were being used, and you will notice in green there was a large number of phone consultations and followed by video consultations and email consultations and coaching compared to what was being done prior to the pandemic. The number of home visits and direct therapy or treatment in the centers had reduced considerably. Let's look at how helpful did professionals find remote consultations to bridge the pandemic period. And nearly 50% of people felt that this was going to be particularly helpful even going forward and to replace some of the therapy sessions by remote consultations in the long term. It is interesting to note that physical therapists found remote consultations less helpful than pediatricians, pediatric neurologists, educators, and psychologists. And how helpful did family and caregivers find the remote consultations? And you will note that again, nearly 50% of families rated it over the midpoint mark, with around 20% finding it pretty helpful in the extremely helpful end of the spectrum. One thing to note is that the amount that the caregivers found the remote consultations to be helpful was not related to the disease severity of the child. And this was probably related to a whole range of other factors relating to the availability of the teleconsultation, availability of software, the internet connections, and the technical expertise of the individuals involved. There was another major silver lining which families commented on. There was an increased amount of time that families were able to spend with the children. They were directly involved with delivering care, and there was better involvement of children and family with the therapy and the care process. This resulted in an improved confidence and self-reliance. Some families also reported increased family connectivity, with caregivers commenting on their pleasure in seeing all that their children could do, which possibly they weren't being able to observe when they were busy with their work lives. There was also the opportunity to redefine the user-professional partnerships, and certainly these were considered a significant benefit for a good number of families. We also asked families and professionals on what advice they had for policymakers, and this we have categorized into three particular areas. And the first one is inclusion, and families felt that any kind of planning needed to be inclusive or disability inclusive. So involving people with a disability in the decision-making process, both now, but also for future planning. We need to put the needs of the people with a disability at the forefront, and policymakers need to be cognizant of this. keep in mind the impact of the guidelines and the restrictions when on children with disabilities and their families, and make concessions for them to be able to maintain both the quality of service for their children, but also for them to be able to maintain some degree of normalcy in their lives. The second category was regarding information. And there was a need to provide clear, consistent, and realistic guidelines and information which was specific for children with disabilities and their families. They wanted policymakers to take advice from experts in our field, which is the services for children with disabilities. So clinicians, researchers, frontline workers, and also families to be involved in providing this information. And thirdly, it was around support. There was a call to provide adequate resources and also support to mitigate the long-term implications of the COVID-19 pandemic and the accompanying measures. And this also sort of goes beyond the COVID-19 pandemic into any future pandemic or any global event. There needs to be, we need to ensure the provision of adequate socioeconomic and financial support to ease the burden placed upon families. And there was a need to not implement austerity measures in subsequent, which is the aftermath of the crisis. What people also talked about was the need for flexibility in the support measures which were being provided. So to summarize the key outcomes, we had a strong decline in treatment provision. There was isolation of families and the burden placed upon them. And also we found future challenges and opportunities which families and also professionals talked about. We now have some time to look at and discuss some of the questions coming through, but I would like to point you towards the European Academy Europe 2021 meeting, which is starting from the 20th of May in a couple of days' time. And the first day of the conference, which is on the 20th of May, we have dedicated it to discussing the childhood disability in the era of COVID-19, where we shall further discuss a large number of issues which the COVID-19 pandemic has thrown up, both for children with disabilities, their families, and also us as professionals. And I would request you and encourage you to please join us on that day. Hello, welcome everyone. Thank you for joining us this afternoon. And before we start with the questions, and I know that there has already been some questions submitted, I would like to invite all of you to post further questions. We have just over 20 minutes to discuss some of the questions. So thank you again for participating. So let's look at the questions that already are being posted. Did you notice any geographical differences or any correlation to stricter lockdown measures? We certainly did, and I'll ask Marco to probably take that. He'll give you details of the differences.
Yeah, thank you, Arnab. So yeah, we did indeed find differences here, in particular related to that stringency level of the implemented measures there. So what we did there is we used the data that's provided by a group of researchers from the University of Oxford, who made a stringency index based on the implemented measures and restrictions within particular countries, and we related this, among other, to the burden being placed upon family caregivers as we presented, and we see that there is a link there. And again, there will likely also be links there to the access to treatment, because we see that there is within the family caregivers quite a lot of fear for contagion, in particular in that period of time, April, May 2020, and when there are more strict measures, there is likely also, it's a bit a hypothesis, but there is likely to be more fear for contagion because likely this virus is spreading more widely in those countries at that point in time. I think this relates to a certain extent also to the geographical differences. Perhaps one notable country there is, of course, Sweden, which used a different strategy there in the beginning of the pandemic in those first months, which with less strict regulations. And we also noticed there that the scores or the outcomes from Sweden are somewhat different than in other countries. Likely linked to the fact that there were less strict measures there in place.
Can I just add to that, Marco, which is when we did the austerity survey just a couple of years back, one of the things which was very evident to us was the varied government systems and provisions in place. So different systems, but also within Europe, we have huge differences in the amount of or percentage of GDP being spent on disability care and the wealth between countries. And certainly the impact was far more evident on the most vulnerable countries and the poorer countries. And given that we are now nearing around 18 months into this pandemic, we are really worried about the impact this is having, particularly on the more vulnerable sections, plus also the poorer countries. Shall we take the next question? How much did socioeconomical factors impact the survey answers? I think this is slightly linked to the previous question to some extent, in that the socioeconomic factors are both country specific and geographical location specific, and then of course there is the individual circumstance of the family. And there was a clear indication that when families were really struggling even prior to the pandemic to meet their needs, they were the hardest hit. And they were the ones who experienced the highest amount of stress, anxiety, and worse health outcomes. Whereas some of the more positive outcomes which were reported from families around being able to spend more time, being able to see what their children were doing, those were more the families who did not necessarily have to worry about a lot about their own financial security, their food security, etc. Do you want to add to that, Marco?
Yeah, maybe I can add a bit to that. So we also asked in the surveys if there was any financial impact. Also, let's start with on the family caregivers. So there, but basically 50% said that they experienced a financial impact due to the COVID-19 pandemic and implemented measures, and the other 50% indicate to not have experienced such an impact, which I think gives us, with our survey responses, a quite balanced overview there between the two groups. What we did notice there is that, in particular, when we also look into some long-term concerns there, is that the group where there was an financial impact in those first months of the COVID-19 pandemic, that we see that they express a lot more worries and stress and anxiety about the upcoming months there.
Thank you. Shall we take the next question? Which is, do you see more behavioral problems around feeding times? We certainly had a much higher report of behavioral difficulties reported during the pandemic, with I think around 56% of children being reported to have more significant behavioral difficulties. And around feeding, there was an interesting spread, which is that around 16% of children were reported to have a decreased appetite. And conversely, about 21% of children were reported to have an increased appetite. And clearly, the pandemic was having different effects, both on the feeding behavior, but also probably a reflection of the mental health impacts that were going on. And added to that, the lack of being able to go to school or access outdoor spaces led to more sedentary lifestyles, and the impact of these feeding differences, along with the other changes in behavior, would have had a substantial effect on their health. Do you want to add to that, Mark?
No, I would fully agree with this, Anna. Thank you.
Thank you. Shall we see the next question, which is, did you notice that reduced access to treatment, including nutrition therapy, impacts child growth? Marco.
Yes, I'm happy to answer this one. So I think, yeah, we noticed indeed that over the entire board there is a significant reduction there in access to treatment, and that also includes to nutrition therapy or diet therapy. We did not specifically ask on the impact on child growth. I think also there it's important to take in mind that our survey, of course, took place within 1 to 2 months after the start of the pandemic, which might be a bit short term to already look into the impact on child growth. However, what is, I think, important to note here is, and that follows a bit upon something Anna already touched upon a bit earlier on, is that these lockdowns and these implemented measures, they of course negatively influence quite a lot the mental health of the people, the learning process also at schools, and the level of sedentarism of children with disabilities. And as we know, the very positive impact of a healthy lifestyle, I think that it's both physical and mental health. I think it's going to be very important to really promote a healthy lifestyle and the promotion of healthy habits, such as a physical activity, appropriate sleeping behavior, and also a healthy eating behavior. And that should be a priority, I think, in the upcoming years. And perhaps not only focused on the children, but also on the family caregivers, as they are an important role model for those children as well. Not sure if you have anything to add here, Anna?
Yeah, just briefly, in that the survey group, professional group, which was just under 1,800 people, about 6% of the respondents were dietitians. And certainly across the board, there was a report of reduction in access to therapy and treatments. And specifically regarding nutritional advice, it was the figures were more than 50% reduced in terms of what the families reported in terms of access to nutritional advice and dietetics. So one other thing to recognize is that because a lot of the children, in terms of their monitoring of the growth, it would happen within healthcare settings or within school settings, all those safety measures of monitoring the growth had kind of become less available. So therefore, it is quite difficult to know exactly how the child's growth may have been impacted. Shall we go to the next question, which is around, do you have information about the impact depending on the model of delivering services? I mean, for example, did you find differences among families that followed a home program prior to the pandemic and families that didn't?
It's a good question. I don't think we have any data on that regard, because we didn't. And I think also what is important, I think, to recognize here is that many people during the pandemic, of course, got for the first time telehealth solutions. And I think if there is a bit of a silver lining here, is that we really recognize that telehealth can be a solution for a lot of things that we didn't recognize before the COVID-19 pandemic, and that it is a solution for a lot of people living in rural, isolated areas, and that it can make healthcare more accessible. Yeah, and do you have anything to add there, Anna?
I guess we did not ask specifically the question around how many of our respondents were already on a home program, whether it was like coaching, which might not have been telehealth, but certainly what became very apparent was that the amount that families were involved in delivering home programs was substantially higher. And that would suggest that even if they were involved in a home program or a coaching system, that it is likely that they were having to take on a significant extra in terms of delivery of the program. Shall we take the next question? How would you explain the 50-50 division about the helpfulness of telehealth? How should this advise our future policy? How could we better incorporate telehealth from financial and structural support? I'll let you go first, Marco. I know this is right up your street.
Yeah, so I think again here we need to take in mind that this happened within a period of 1 to 2 months in which a sudden change had to occur from people who never used telehealth to suddenly switching to only being able to provide telehealth. And well, change always comes with some starting up problems. So I think there we also need to realize we didn't ask that to the professionals, so well able they were to work with technology in general, even before the pandemic. But I can imagine that there are, of course, some issues that may explain how helpful people found telehealth. But I think there, what is important is that already within such a short period of time in which people had to be really creative in how they implemented telehealth in far from ideal situations in which there were less team discussions, less support from IT, less support from administration. Already 50% indicates that it is an interesting model for the future and helpful for the future. So I think when we go on in time, this is yeah, I think that if you would ask the same question now, the percentages will be higher than the 50-50 that was there at that point in time. In regards to the financial and structural support, there is that it's going to be very important there, of course, that the therapists are receiving training in the use of those telemethods. And that's not something that we can just take for granted because they have a phone and can call someone, or that they can make a Zoom call, that they know how to use telehealth in an appropriate setting. And there needs to be resources to allow these people to be trained in these in the provision of these telehealth services.
Could I add to that, please, Marco? I think in terms of telehealth, we need to look at it from both the perspective of the families and the children, but also in terms of the professionals and also policymakers or governments, because there is the issue around people becoming comfortable in the use of technology, but there is also the issue around provision of the appropriate high-speed internets or the access to software and hardware, and making these much more accessible is going to be important. And that is both at a policy level and also at a systems level. Certainly, in terms of going forward, what we would anticipate is that we would not go back to what was normal, because the future would be a nice sort of a optimal combination of both direct healthcare along with telehealth, and there is a role for both. And depending on what service we are delivering, it is for us to identify where that optimal point lies, where both the needs of the families, the patients are met alongside the requirement for therapy or interventions or whatever it is that we want to do.
Yeah, I think that's a very important point, Arnab. And I think also here, I think it's good to highlight that this indeed should not be an excuse to not also invest in infrastructure for just regular face-to-face treatments, because telehealth is not a solution for everything. That's also something we learned during this pandemic. And I think also there moving forward, it's going to be important that the quality of rehabilitation care and service delivery should also be assessed to the same standards as conventional face-to-face rehabilitation care, even though we in the beginning of the pandemic maybe just were happy that it worked a bit, which was better than nothing.
And of course, the advantage of telehealth far exceeds the user professional boundaries. For example, in terms of the professionals, our regular teaching, training, networking, and what we are currently engaged in, all of these methods have changed our lives enormously. And certainly there are huge benefits that we will take forward from this. Next question. Did you ask about the impact on the family in case of the child became sick of COVID-19? Yes, certainly people were extremely concerned about, particularly you must remember this was in the first wave when it wasn't completely clear about the impact the virus was going to have on children. And now we know that children are relatively protected. So people were extremely concerned about their children's health. There was a fear of accessing hospitals or elective care. And in terms of what was emergency care and what was elective care, all of those boundaries became a little bit blurred, both for families, but also for the service givers or service providers. Certainly, there was an impact both on the child directly and also significant impact on family members. Marco, do you want to expand on that?
Yeah, I think that's to follow up on what you already stated there. I think, yeah, of course, there is a great impact there if the child becomes sick of COVID-19 or even the caregivers themselves get COVID-19. But I think what also very important there is that for a lot of them, already the fear of that happening limited them severely in what they could or couldn't do, and really made them isolate themselves to prevent this from happening because of the consequences it would have. Yeah.
Probably one thing related to this, which is worth mentioning, is that when even the child was relatively well, if there was a family member who was extremely vulnerable, families became extremely careful about anybody from the household accessing care or accessing leisure activities or accessing anything outside the household. In addition, their support systems often, these would be friends, family, grandparents, and a lot of those support systems became hard to access because a lot of those people would be in the vulnerable category. So this had a negative impact on multiple levels. Shall we take the next question? Did the survey consider children fed orally and/or via tube feeding? And did the answers to the survey differ among them? We certainly didn't ask specifically, but we do have some indicative measures. Marco, do you want to talk about them? Yeah.
So we did indeed not ask directly if the child was fed orally or via tube feeding, but what we did do, and that's likely going to be indicative of this, is that we did ask how dependent they were on their care on others. where we asked them to indicate whether that was comparable to age-matched peers, partially dependent on others or completely dependent on others. And what we see there is that there is a clear distinction between those three different categories, with the decline in the amount of received treatment much higher, more decline within that group, that most dependent group, and also the ability to cope with the situation is the more dependent they are on others for their care, the more difficult to cope with the situation it was for them. And also the burden placed upon the family caregivers. Again, the more dependent the child was on the care from others, the higher the burden was that was placed upon the family caregivers. Again, this is not directly whether the child was fed orally or via tube feeding, but I think it's very indicative of what will be the outcome probably here.
Thank you, Marco. I'm aware of the time. We're nearing the end of the session. We will take one more question, but we are very happy to take further questions on the platform, and we will subsequently provide answers to those. So please do keep posting, and we certainly will answer them on the platform. So the last live question is, do you know if the treatments have been re-established by now? And this, of course, is not relating to the survey. This is based on our personal experience. And this is variable dependent on the country and what the situation is in relation to COVID-19. Certainly, there have been many ups and downs, or waves, as we call it. And there have been a number of countries which have looked at providing appropriate services or alternative services wherever possible, and have invested in both training and infrastructure to make them possible, for example, with telehealth. But certainly we are nowhere near back to providing the right level of care, whether it is in terms of health or social support or education for either the children, or providing the right level of support for the families, whether financial or otherwise, or the flexibility in accessing those services that are hugely required. And we would hope that this would be looked at by policymakers and implemented in the near future. Thank you very much for joining us today. It has been a great pleasure. Thank you to our hosts, Nestle, and also to the EACD for providing us this opportunity to present our EACD survey findings to yourselves, and we look forward to future such webinar opportunities. Thank you.
Thank you.